Welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terrence Deyalsingh, and the Chief Medical Officer, Dr. Rishard Khan. Let us now hear from the Minister of Health, the Honorable Terrence Deyalsingh, who will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to you. Good morning to the Chief Medical Officer, Dr. Rishard Khan. A very good morning to ladies and gentlemen of the media and to all persons who are listening or viewing, whether you are in Trinidad, Tobago, or any part of the world. The coronavirus pandemic means it affects a lot of countries. It is now affecting 213 countries and territories around the world. Almost, if not every single country in the world is part of this global pandemic. The global caseload is 6,488,246 as we speak. Almost 5 million. That's a lot of people. The death toll to date is 383,213. 383,000 persons have died, and about 3,090,734 have in fact recovered. Ladies and gentlemen, it seems as just yesterday, not literally, but recently, when we started alerting the population as to what was the caseload per million, so you could have a comparator from country to country. The caseload per million when we first started this, and I should have kept the date, but I think it's probably about a month ago or a month and a half ago, stood then at 120 cases per million. 120 per million. Now it is 832 cases per million. What that means is that there has been an almost 600% increase in the global caseload per million population. A 600% increase. That is phenomenal. And this seems not to be slowing down. We don't know where it will be in a week, a month, or a year. Ladies and gentlemen, the government of the Republic of Trinidad and Tobago, led by the Honorable Prime Minister, Dr. Keith Rowley, together with healthcare workers in Trinidad and Tobago, have done an absolute world-class job in minimizing the effects of COVID-19 on the 1.4 million souls that we have responsibility for. So a collective thanks must go out to the Prime Minister, the Cabinet, and healthcare workers. They have done a world-class job. But to continue this world-class job, the baton now passes, and I'm hoping that the persons responsible for receiving the baton, so to speak, like in a relay race, you pass the baton from one to another. The part of the community that is now responsible for accepting this baton to continue this race is going to be the general population. Because our borders are closed except for the limited persons coming in via protocol. But the baton is now passed on to individuals to continue this world-class job, especially as we anticipate phase 4 of the reopening of the country, of the economy. And there are two sectors of the public that I would like to speak to this morning. And contrary to what one newspaper said yesterday, I am not chiding anybody. I am advising strongly, and I'm having a conversation with strong advice to two groups of persons who have a very serious responsibility now in helping the government continue this world-class effort. The retail sector After Monday's press conference, I went down to Independence Square. I visited the 4 banks on Independence Square, and I could not be more pleased with the response of the banks in controlling access into their banking halls, ensuring that masks are worn, hand sanitizers, social distancing. I could not be more pleased. And I want to recognize Republic Bank, First Citizens Bank, Royal Bank, and Scotia Bank. I even saw a Republic Bank worker with a mask on with the Republic Bank logo, so that is good. So I really want to thank the banks. And all corporate entities. I have noticed that the corporate entities are really leading from the front. The bigger companies, the larger companies that have a strong sense of corporate identity and corporate responsibility. I also walked through 2 malls on Independence Square. One which goes in an L shape from Independence Square to Frederick Street. And across Frederick Street, I walked into 2 other malls there. And I could not be more pleased with the response of the owners of those malls. They had people with hand sanitizers at the entrances and exits. Without failing, Minister Cox, almost every store in the malls that I walked through, the employees had on masks. So that heartened me. Again, the corporate response was good. But when you walk into the single owner operated stores, that is where I think we need to have a serious conversation. Because even though some of these individual, independent, single owner stores, and I was pleased to see one place, I'm not going to call the place, had a sign, no mask, no service, on Independence Square when I walk in. Yes, you have the policy. Yes, you have the sign. But it's not being implemented inside the store. Customers were there without masks. So corporate Trinidad and Tobago seems to be responding brilliantly. But we have to drive the message down to the smaller stores. And I even took a drive up to Sangre Grande last week to visit the Sangre Grande Hospital. This is just one instance. It seems that in the rural areas, as you leave Port of Spain, as you leave the town centers, the incidence of wearing masks and being responsible seems to decrease. It seems to decrease. That's my just observation. I even saw 4 fellas in a fruit stall on Eastern Main Road, Sangre Grande, playing cards around a table within 3 feet of each other, and not one had on a mask on Eastern Main Road, Sangre Grande, in the fruit stall. So I really want to congratulate those who are living the policy, because it's good to have the policy, but then you have to live it. And encourage the medium and smaller entities to follow corporate Trinidad and Tobago and implement it across the board. The other sector that I'm concerned about, and I did raise it on Monday, is public transport. The maxi-taxi drivers, the taxi drivers. So again, after Monday and Tuesday morning, I actually stopped in by the Sawa stand there on the Quasi, and I spoke to a group of taxi operators as to why they're not wearing masks. And you get a variety of reasons. And then I stopped off at the South Key, San Fernando, Port of Spain to San Fernando taxi stand. And again, I spoke to taxi operators to get their input as to why they're not wearing masks. So you got a whole range of reasons. Same thing with maxi-taxi drivers. So what I have asked my colleague, the Minister of Works and Transport, to do is to set up a meeting with myself, possibly the CMO, and the heads of associations of the Maxi Taxis Association, the taxi associations, because I am very concerned about the lives of our taxi operators. Because by the nature of their work, the nature of their job, they need to understand that wearing a mask, especially when you are inside your maxi taxi or your taxi, You don't know who you're picking up. It is very important for these categories of people, taxi operators, to wear a mask. It not only protects them, it protects their families when they go home on afternoons. So I'm concerned about small and medium-sized retail, and I'm very, very concerned about public transport. I've noticed the bus drivers, PTSC, because again it's a corporate entity, they seem to be wearing masks. But as I close off, I just want to re-emphasize that out of the city center, as you go out, it is important to wear masks. Even when I was on the Independence Square on Monday after the press conference, on both sides of Independence Square, which sandwich Brian Lara Promenade, yes, the banks are doing a wonderful job. Yes, some of the malls are doing a wonderful job. But in the middle on Brian Lara Promenade, the people, the regular people who lime and make Brian Lara Promenade their place of recreation, literally no one is wearing a mask. So some pockets of the population are hearing the call, but we have to work even harder with other parts of the population. So today, as I close, I just want to remind people that the proper wearing of a mask covering your nose and mouth is absolutely crucial as we pass the baton now to do a world-class job. Let us be a shining light for the rest of the world that Trinidad and Tobago continues to do a world-class job. And wearing a mask in public is an absolute crucial part of that. I even saw masks being sold for as little as $10. So it's not an expensive thing. A young lady was selling a mask for $10, walking around with a tray. A man on Frederick Street outside the mall had masks from $20 to $50. So the masks are inexpensive. Get it, it may save a life. Thank you very much, Minister Cox.
Thank you very much, Minister. I think it's an extremely good idea about that meeting with the maxi taxi operators. The Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Okay. Good morning, honorable ministers, members of the media, members of the viewing and listening public. So the update as of Wednesday, the 3rd of June, 2020, in terms of tests submitted to CAFA and UE, 3,211. Number of repeated tests, 440. Number of unique patient tests completed, 2,771. Number of community samples done thus far, 1,377, of which 132 come from Tobago. Total number of patients positive remain at 117. Number of discharges at 108. Number of deaths at 8, 7 in Trinidad, 1 in Tobago. In terms of the parallel sites, facilities, we have 69 persons in the parallel system altogether, 59 persons at the Debe Penal Center. At the Cascadia Hotel, there are 7 individuals, and at the Homer Football, there remains 3 individuals. I just want to have, if we could have the first slide, please, a brief discussion on the effects of public health measures on diseases other than COVID-19 in Trinidad and Tobago. So when we look at the measures that we would have taken, the broad measures, schools would have closed, I believe, on March the 14th. We would have closed the borders on March 23rd, and we would have issued a stay-at-home order dated March 30th. So the overarching effect, we're looking at the first graph, which depicts the respiratory suspected cases of influenza disease in Trinidad and Tobago. So influenza is a vaccine-preventable disease. The blue line that you see is the actual number of cases of influenza that you will see. The green line, the green, yellow, and red line indicates the control for green. Yellow gives you a little bit higher endemic level, and the red goes to alert. So basically how we get the green, the yellow, and the red is a culmination of 5 years of data on that particular illness. We add them up and we create what is known as the endemic channel, which gives you different levels: control, endemic, and alarm. So looking at the blue line, we have on the top acute viral illness from January to present. So you see the blue line would have started in January within the endemic region. Just around March or thereabouts, it would have gone up into the alarm region. So if you go above the red region, you're into epidemic periods. When we reach around March, where all these public health measures would have instituted, you see a drop from March onwards to what we call Epi Week 21, which is a week ago. It's a consistent drop going all the way down to the lowest level possible last week, which was just about, I would say, about 30 cases for the entire week. If we go to the other graph, this shows you influenza. The first one was acute viral illness. So acute viral illness is a sort of what we know as common cold. Influenza is what we know, some people call the flu. So we're seeing that for the influenza from January all the way to present, it was actually within the control zone. Remembering the difference between the first graph and the second graph, this particular disease is vaccine preventable. The other disease that we showed before is not. So it was well controlled. As you know, our vaccine for influenza, we are up now to 114,000 doses given out for the last flu season. So we see a consistent, well-controlled disease. But look at the last 5 or 6 weeks, where after which March we had our public health measures, it dropped to almost negligible. In the last week, we actually saw almost no cases of influenza popping up. We're coming out as well to the end of the influenza season, which is May, so that gives you some idea. The last two graphs will speak to gastro. If you could go to the other graph. Gastroenteritis, first in the over 5 age group, is categorized over 5 and then under 5. So again, you're seeing a steep drop. It was in the alarm phases in the early part of the year, generally January and February, which is common to see. So you see a steep drop after when we're coming into the end of February, early March, all the way down to where we are now, which is the lowest level we have seen for over 6 years. So again, it's a very steep drop. And if we go to the final graph, which speaks to children less than 5 years of age, we're seeing a similar pattern with gastro going up into the alarm. And as soon as we did the public health measures, we see it's dropping all the way down. So I just wanted to show these graphs this morning to put some perspective. One, as the number of cases of viral illness, gastroenteritis, influenza, to show you the numbers are actually coming in to the facilities are decreasing significantly. You would have seen our community sample decrease a little bit over the last few days, but the reason purely is that persons are not coming into our facilities as they would have been before. And we see nationally, if you look at a 6-year trend, that the actual decrease, there's a significant decrease in the number of infectious diseases that are occurring in Trinidad and Tobago other than COVID-19. It's a knock-on effect of the public health measures that we are seeing, and we're happy to see that decline as well. So, Minister Cox, that's my update for this morning.
Thank you very much, Dr. Parasuram. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your questions. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. 98.1.
A very good morning to you, Stephen Cummings, 98.1 FM. My 2 questions quickly, one for Dr. Parasuram and the other for Minister Deyalsingh. Dr. Parasuram, the World Health Organization has alerted us to a new outbreak of the Ebola virus disease, a complex Ebola outbreak in Eastern Democratic Republic of the Congo. It also comes at a time when we are treating with the COVID-19 issue. While we are thousands of miles away, Trinidad and Tobago that is, are we in any state of, let's say, preparedness or readiness to deal with any such likelihood? As I said, we're also treating with the Ebola, with the COVID-19 issue. And Minister Deyalsingh, how far advanced are we in our collective and clinical studies from a policy standpoint of the 116 recovered cases? We have been able to see, have we been able to see any general indicators as to, what can help us further understand the virus as we talk about the COVID-19 virus?
Sure.
Thank you.
Okay. So in terms of the Ebola outbreak, you would have known there was a large outbreak in 2014-15, same region of the world. So we are keeping an eye on this particular outbreak. There's a national Ebola plan, which is actually well thought out, operationalized. It is very similar to the influenza plan in the way that is rolled out. So being prepared and having the preparedness for COVID, also has some effect on preparedness for any other infectious disease. So I think we are well placed to deal with any outbreaks as it relates to Ebola. However, having said that, our borders remain closed, which is the main, I remember in 2014-15 as well, when there was that epidemic, we would have closed the borders to certain nations, 5 in all, starting with Western Africa, states in Western Africa, to prevent persons from those countries coming into Trinidad and Tobago. So the borders being closed, there's little or no possibility of someone from that part of the world can get to Trinidad at this point. However, having said that, we will continue to prepare using our Ebola plans if and when our borders reopen and the Ebola epidemic continues, that we have things in place to deal with that eventuality.
Thank you. So let me just pick up on where Dr. Paratram left off on Ebola from a policy position, and then I'll go to Mr. Cummings' second question. The chances of Ebola reaching Trinidad and Tobago are close to zero, not only because the borders are closed, as the CMO has said, but because of two other factors. One, there is now an approved vaccine for Ebola, which was approved by WHO and CDC last year. So the use of a vaccine for Ebola is going to have a very serious positive impact on the possibility of that cluster of 5 cases becoming first an epidemic and then a pandemic. The other, if I could say a good thing about Ebola, there's no good thing, but epidemiologically speaking, because Ebola is so deadly, as opposed to coronavirus, that's the main thing. Because coronavirus does not kill in the numbers that SARS and Ebola kills, is what makes coronavirus so transmissible. Because you have these asymptomatic people crossing borders. With Ebola, it's different. So that just further enhances what Dr. Parashram has said. On the learnings, as we indicated, we are doing a retrospective study of our coronavirus cases. The update that I had this morning, because we meet on that every Wednesday morning, is that a questionnaire is being developed or has been developed, and we are now reaching out to the 116 persons who have recovered to get their experiences, and then the learnings will come when we finalize the report, which will be made public. It has to be made public, and we are hoping to finish all 13 papers by the end of July. So that's where we are with that particular learning. 108 persons who have successfully recovered from the virus, and we will make that publication public, because that's the only way it adds value. Thank you very much.
Thank you. TV6.
Hi, good morning, everyone.
Good morning.
2 quick questions. With the numbers, the global caseload numbers increasing, how soon could we say or predict that herd immunity might occur before the actual vaccine is here? And since we know that the total numbers of cases globally, we know those numbers, but how much cases are discovered per day? Are we seeing a rise or fall in these numbers? And if so, what would be the measures taken going forward?
Okay, so I'll give the general policy context, and then the CMO will give the clinical details. As far as your question on herd immunity is concerned, I don't think we have any data to suggest what percentage of the population needs to have contracted coronavirus to give herd immunity. Why? Because this virus is only 4 or 5 months old. We just don't have enough experience with it. We don't have enough data to determine what level of herd immunity you need. We do know over decades and decades of experience with things like MMR, where you vaccinate people. To get herd immunity, you need to vaccinate about 97% of the population. But at this point in time, no one in the world can tell you what percent of the population needs to have contracted coronavirus to get herd immunity. I'll hand you over now to
Dr.
the CMO.
Parasram?
So in terms of herd immunity as well, I mean, as Minister said, it's a multifactorial thing. So it depends on a lot of characteristics of any individual population. So if we were to behave as if a population were homogeneous, meaning that everyone is the same, the houses are the same distance apart, the density of population is the same, ages are similar, vaccine status are similar, then it may be able to be calculated using statistical modeling. But that is not the case. And it varies from state to state, from place to place, even in Trinidad, as to what percentage of an individual area you would require for to be infected, to have herd immunity developing. So to give you a number, as Minister said, is very difficult, but the modeling has to occur in the individual areas of the world, and they can come up with a rough estimate of what they need for herd immunity. In terms of, there's a second part to the
He
question?
wanted to know the rate of increase in cases.
Internationally.
Yeah.
So-
We will have to check on that one for you.
We can get back to
We'll
you
get,
on it.
we'll
All
get
right?
back to you on that one.
Okay, we'll move on, please. Before I come off of TV6, Elizabeth Williams asks a question about non-payment to persons employed in the reforestation program. So I'd like you to take the information to her that the Conservator of Forests has advised that all persons employed by contractors in that program have been paid. We move to 95.5.
Good morning, Whithfield Turner from my 95.5. I have a question each for the Minister and CMO, as well as two requests. I don't know if I'll be able to get that in. CMO,
What did he say?
can you tell us how possible it would be for persons who are going to be allowed in via cruise ships to quarantine? And for persons who actually reside in Tobago, will they be allowed to do the quarantine in Tobago, thereby freeing up some more rooms for quarantine in Trinidad, and of course, bringing them closer to their families and so forth? And also for the Minister, if you can just clarify, because apparently there is some ambiguity there. Hotels, are they allowed to be open at this particular point in time in this phase?
Yeah. So some hotels, especially those catering to the bringing in of persons working in the energy sector, they are allowed to be opened. Some hotels, I think under the regulations, but we'll check, are allowed to be open, because we did announce on Saturday that you could have dining for your hotel guests once they are outdoors, right? So that's my answer. And before you go to the CMO to answer the question about the rate of increase, I'm on it now. The rate of increase over the past, let's say, May the 22nd to June the 2nd, it seems to be coming down slightly, but it fluctuates between 100,000 to 125,000 new cases per day. So, just to contextualize it, from May 11th to May 22nd, it fluctuated between 100,000, 80,000. Then, after that, from May 22nd to June the 2nd, it fluctuated between 100,000 to 125,000 new cases per day. So whilst there is some fluctuation, there is no precipitous decline as yet. So I hope that answers the question that was posed earlier. Thank you.
Okay, so in terms of the question related to cruise ships normally pose a medium to high risk in terms of having an infectious disease. So if you're speaking about quarantine coming off a cruise ship, what we try to do is once you get off that ship, you're taken to the closest port of call. So if that is Trinidad for the majority of people, wouldn't want to transfer that individual by air or by another sea vessel to go to Tobago to quarantine. However, having said that, if you're dealing outside of cruise ships now, you would have noted that Tobago actually set up quarantine stations within hotels in Tobago during the epidemic itself. So Tobago can be used, and they can use their hotels for quarantine sites, and have done so in the past as well. I think he has a question, a follow-up.
No, I think
If
it's a
you-
third question. He'll get the opportunity a little
No, I
later.
think, all right, okay.
AZP News.
Hi, good Morning, Prior Bihari, AZPnews.com.
Morning.
Minister, as more and more people come in, as they get permission to come in and they stay in quarantine, is the ministry going to continue to bear that cost of quarantine? And can you tell us how much we have paid, the ministry has paid so far to keep people in quarantine? And I have another question regarding
we got
CEDA.
two questions there. Hold on. We have two questions. We'll come back to you.
Okay.
The minister will answer your first two questions, and then we'll come back to you.
Okay, so Prior, I will try to, I wouldn't have a ballpark figure as yet, but the issue of paying for quarantine, I think it is something that may have to be considered as the numbers go up and up. I see Jamaica is taking that stance. I don't have a firm decision as yet. That will be a decision made between Minister Young, myself, advising the Honorable Prime Minister. I can give you some rough figures as to what it costs to quarantine and set up quarantine facilities. So, for example, the Tack Center, which housed initially the 33 citizens from Barbados, that would have cost roughly about $1 million to set up. Just to set up. You have to add to that catering, staff costs, consumables. The DB Penal campus cost roughly that, but then UWI would have spent some money, a couple $100,000 for perimeter fencing and some perimeter work. That does not include meals, it does not include consumables, it does not include staffing costs. The Brooklyn Center, I think we rented that at $120,000 per month for initially 3 months. That center has been waiting for another group of persons now for close to a week and a half. Balandra, I think we paid about $85,000 per month. That was for the first set of cruisers who came in from Guadeloupe or Martinique, was it? Guadeloupe. So those are some of the costs. It's a very expensive process to accommodate this, and so far the taxpayer has been carrying that burden, and I want to thank most sincerely the taxpayer for their generosity in this time. Thank you very much.
Thank you. Tobago Channel 5.
Good morning, Candace Jackson from Tobago Channel 5. My first question is, are we also testing for Ebola now that it's becoming a threat? And even though the likelihood of getting it is very, very low, are we also testing for other things like that as persons are coming into the country? And my other question, which I'm not too sure if you guys can answer, but I need to ask it anyways. We had the Prime Minister yesterday stating that persons who may be on half a salary and their employers are sending them out to the government to get the grants and so on, and it's essentially fraud. It's actually some of the things that are slowing up the process of the processing of the grants and whatnot. Now, what are these persons supposed to do that as they were waiting for those grants, especially rent and all those things to come through, but they can no longer, count on those things coming through, and they might be so stuck on part salary, and everything's going to start piling up. The end of the deferral period for the loans and so on is coming up. So it seems
Candace,
these persons are now...
Candace, the second part of your very lengthy question has to be addressed to the Ministry of Social Development or the Ministry of Finance. It's a very lengthy but important question, and I would advise you strongly, this is the Ministry of Health responding to COVID. It's a very important issue you are raising. This is not to make it any less important, but we don't have the answers to that. I would advise you to address it to the relevant ministries and or ministers, and the Chief Medical Officer will address your part on Ebola.
Okay, hold on. Before she goes on, just tell me clearly what it is you want to know concisely, and I can try to find out.
Persons who are on, I guess, half a salary now, still on half a salary, are being faced with the end of the deferral period coming at the end of the month, as well as, they would have been counting on the grants to cover rent and so on, that they may not have been able to pay during this period because of their cut in salaries and whatnot. What are these persons supposed to do now that they may not qualify for the grants based on what the Prime Minister has stated?
Okay, I'll check with social development and
we'll try to get an answer for you.
Okay. Dr. Parasram?
Right, and so the answer is no with regards to testing for Ebola. So at this stage, we wouldn't be testing for Ebola. Ebola is something we call a class 4 pathogen in terms of biological containment level. So Trinidad normally sends that to the Caribbean Public Health Agency, and they actually send it abroad to CDC for testing if we have a possible case. That scenario will continue for now. In terms of other pathogens for respiratory, we have a 14-panel screen that is run by CAFA, including H1N1 and other viruses that we do routinely for any sort of viral illness. So that covers other pathogens that are possible in the region to be circulating.
Thank you. Express?
Good morning, Camille Hunt, Express.
Morning.
Good morning.
Minister Deyalsingh,
Yes.
my first question has to do with the protests taking place across the U.S. I've seen people making calls and urging people in Trinidad to show solidarity by protesting at the U.S. Embassy. Is the Ministry of Health concerned about people possibly gathering to protest? I know it's an issue that many people feel passionate about, but given the COVID restrictions, what is the ministry's advice?
I love it.
Also,
Next question.
You are
we're
groups of
constantly
5
being
and that's it. That's the answer to your question. Groups of 5.
Next question, please.
We're constantly being reminded to wear masks, but we constantly see people disregarding this advice. I know last month you had said the issue of legislating the wearing of masks, particularly for vendors, it was before the Attorney General. Where are we on that, or is this no longer under consideration?
Sure. So as the Honorable Prime Minister would have said on Saturday, that issue is now off the table because the Attorney General has advised it is a legislative and implementation nightmare. To charge people for not wearing a mask, you charge them, what do you do with them? Throw them in jail? It's just a legislative nightmare. So that is why we are going the route of very strong moral suasion. And that is why we keep saying, retail shop owners, the same way you can deny service, and you have your signs up saying no short sleeve, no bare back, no slippers, you have the right to deny service to someone without a mask. And that's in my opening statement I said. The baton has now been passed to retail owners. This is your chance to be part of this world-class response, to do the right thing, which is not to give service to persons who do not have a mask. And the logical question is going to be, what about those people who can't wear a mask for medical reasons, like asthmatics? So, you have this, which is now available. It's a shield. This was made by UE. Asthmatics can wear that. This face shield is now being made by someone in AREMA. And this face shield was made by my secretary at home on her sewing machine. So the point is, for that part of the population, like the asthmatics, COPD, that can't wear a mask, these simple things that you can make at home, and I wore one of these yesterday for about 4 hours. After a while, you forget you have it on, are a very effective way for the asthmatics, the COPD, the people with bronchitis, to protect themselves and go out into public. And I'm seeing them for sale now. So the same way I saw the vendors in Port of Spain selling masks for upwards from $10, $20. You don't have to buy the designer masks. This is functional, not necessarily a fashion statement. But this person made this at home. It cost them about $30 in material. It's a piece of plastic, some Velcro, and whatever color you want to wear. Very, very effective. Thank you very much.
Thank you very much. CNC3.
Hi, good morning, everyone. Rishard Khan, Guardian Media Limited.
Good morning.
How are you all going? Okay, I have a two-part question here that I want to ask, but I would like to ask that I get to pose the first part first, and then, depending on the answer, I could ask my follow-up.
Sure.
No problem.
So my question is to Minister of Health, Terrence Deyalsingh. With the reopening happening, and we currently being in the third phase and the fourth phase set to begin soon, a lot of people, from what I've been hearing and from the word on the ground, is a lot of people who are now being allowed to open, they seem to have the impression that it's work as normal. So all the staff are being told to come out. Could you just comment on this for me, please?
I don't understand what the question is trying to get at.
I'm not hearing.
I don't understand what the question is trying to get at.
I didn't hear your response. Sorry, the
Could
audio
you,
is dropping out.
could you simplify the question? It's not clear.
Okay, so all these businesses that are being allowed to reopen as the country is on its way to reopening the economy and on its way to recovery. Some of these businesses, from the word I've been hearing, are kind of under the impression that it's work as normal. So all staff are being asked to come out to work and also just to wear a mask and stuff, but all staff are being asked to come out. Could you comment on this?
Sure. So we would have put out guidelines about a week and a half ago, CMO.
A little more than that, yeah.
A little more than ago. These guidelines were put out after consultation with the Chambers of Commerce, Manufacturers Association, and so on. They are guidelines which stated try to encourage social distancing, try to put desks, try to have some people work at home so as to minimize the impact of having your offices filled. Those are guidelines. We also put out guidelines, a very serious one, that persons who are ill should not be allowed entry. So those are guidelines, doesn't have the force of law. They are guidelines that were settled on after consultation with the business associations, whether it's manufacturing, whether it's the Chambers of Commerce, and all of that. So there are guidelines to assist businesses.
Okay, could we get your next question,
Okay.
please?
Okay, sure. I just want to know if this applies to the public sector as well, because I'm taking a look at the public health regulations, which basically govern the stay-at-home orders, which we had for the longest while, and it says that workplaces, any of these essential services are only allowed to have essential staff to the operation of those services out to work, right? And the way this is working with the reopening is that these businesses or public sector, whoever it is that is being allowed to reopen, is being moved into the category of essential.
Okay.
So
So
therefore, it would be governed by that sub-regulation, not so? Because I have in front of me a circular sent out by the Chief Personnel Officer, which is mandating that all staff who would have been deemed non-essential to the function of the ministries and the ministries really are being told to come out to work now. And some concern has been expressed about that.
So you try to merge public sector and business, so we have to separate them. The Honorable Prime Minister said clearly on Saturday that this will be driven by the permanent secretaries of his office and the permanent secretaries of ministries. I remember the Prime Minister saying clearly that managers should come out to work and there will be a rotational policy for all other employees. If you work on a Monday, you can work from home on a Tuesday and vice versa. The public sector back to work will be managed by the public sector via the permanent secretary in the office of the Prime Minister. Other than that, I suggest you direct your questions to that particular person.
Thank you. TTT? TTT?
Good morning. Crystal Wilson, TTT Limited. Are you hearing me?
Yes, we are hearing you. Good morning.
Right. My question, it could either be responded to by the CMO or the Minister of Health.
Sure.
And it has to do with the fact that a large number of people have recently gone back out to work. And with this comes the responsibility of securing supervision for their children. A number of daycare providers have reached out to our newsroom, and they are asking whether or not consideration will be given to include them in the next phase for resumption of operation. Any response?
It should be aligned to schools.
Dr. Parasram?
So in terms of the phases, school children, as we spoke before, school children cannot social distance, right? Especially smaller children. We expect that the school, anything related to school children should be aligned to the phase where we're dealing with reopening of schools. And that is in terms of public health, that would continue. When we look at opening of schools, generally speaking, every year, you see a spike in the number of infectious diseases right away. Within about a week or two, you see a spike of things like influenza. You see a spike in the common cold, like we just showed before. So once you have school children coming together because of lack of social distance, we can't put all the measures in place that we advocated for the new normal. It is an extremely great risk, and that's why we had advocated for it to be aligned to when we open schools. So basically, we'll be looking at that sort of time frame for allowing school-age children to congregate.
Thank you very much. We go to Newsday.
Hi, morning, Clint Newsday.
Hi,
morning.
morning.
Are you hearing me?
Yes,
Good morning.
loud and clear.
Hi.
Yes, we are hearing you. Good morning.
Okay. I wanted to ask with respect to the public health inspectors. They were supposed to be supplemented, I believe, by some third-year UE medical students in terms of going out and about to do their activities. Has that been going on? And could you give an idea as to how that has been working, how effective that has been in terms of ensuring the various businesses are adhering to the regulations? And also, could you also speak as well to the effectiveness of the public health regulations aspect about no more than 5 people? I mean, in respect to an earlier question, I mean, we do have the risk of, if you have large gatherings for any other types of things, be it protests or anything else, that you could have the risk of super spreads, community spreads, and so on. Is there a concern that you might need to tighten up that particular regulation of no more than 5 people in public spaces, or do you think the authorities have enough leeway to work on that?
Okay, so I'll take the policy part on both, and then the CMO will come in on the technical details. The public health regulations as it stands is at 5. There was debate on Saturday to move it to 10. The only exception that was made was for funerals. So it stands at 5, whether it's 5 people on Brian Lara Promenade, whether it's 5 people on Harris Promenade, whether it's 5 people in Scarborough, Tobago, whether it's 5 people applying to the police commissioner to protest. It's 5 across the board, not 6, not 10. It's 5. On the issue of the public health inspectors, we got the permanent secretary would have written to the dean of the Faculty of Medical Sciences on the proposal. They have responded positively, and it's now being handled administratively to recruit. What I did was set the policy, agreed on a job description, and is now being handled administratively, but they are not yet on the road, so to speak. Mm-hmm. Okay?
CMO, you okay?
Yeah.
All right. Guardian Media Limited.
Good morning, all. One comment from Guardian Media.
Hi, morning.
So, in the absence of a vaccine for the rest of the year, and the foreseeable future, do you envision any scenario where dining services, nightclubs, recreational contact sports like football or basketball can safely resume? And we know that the cancellation of elective surgeries at the onset of COVID-19.
Okay, elective surgeries began over 2 weeks ago, so please don't say cancellation of elective surgeries. They were cancelled initially, but they have begun 2 weeks ago. Let's not go down that road, please.
What I'm saying is that when it was cancelled, it dealt with overcrowding on the wards at the major hospital. So now that it has restarted, I know usually sometimes patients' elective surgeries usually clash on the wards with those who come in via the accident and emergency department. So my question is, what is being done to manage those numbers to ensure that there's no overcrowding, especially as COVID-19 requires physical distancing?
Sure. So there is no clashing, to use your words, of patients coming through A&E and patients getting their elective surgeries. The restart of elective surgeries about 2 weeks ago has gone very, very well, so there's no concern there. The question about contact sports and no vaccine, this is something that is being treated with around the world by all the major sporting organizations, whether it's the Olympic Committee, FIFA, FINA, which handles swimming, NBA, to try to find safe ways for players to start back to train, practice, and play sports. Obviously, different sports are going to be treated differently. For example, boxing. How you start back boxing as opposed to cricket, where in cricket people can be socially distanced. Field placing batsmen are 22 yards apart, as opposed to boxing, where you are in each other's face, clinching, breathing hard. So each sport is going to have their medical boards. Their medical boards advise their international governing bodies, which will then be driven down to country level and sporting level. As far as Trinidad and Tobago is concerned, football, cricket, basketball are some of the major sports. As I indicated in an earlier press conference, the tour of West Indies to England is going to give the world of cricket a very good experimental base to see what those playing conditions are going to be like, which can then be applied regionally and locally to CPL, club cricket, and so on. So it's something we are paying attention to, especially you are quite right, in the absence of a vaccine. How do we safely start back sports? Thank you.
Thank you very much. We go back to ACP News.
Hi, morning again. Yes, I just wanted to find out about the CDAP program. Is it still monthly to get a prescription? And is there any more shortages in terms of the CDAP drugs?
What program, Prior? CDAP? Prior, what program are you speaking about, sir?
He's not hearing.
Prior, you said that program. Which program are you speaking about?
Sorry, you broke out them.
Which program are you speaking about, Prior?
CDAP, the CDAP.
What's your question about it?
Yeah, is there still any shortage of any drugs there?
So
in that program, and do people still have to fill their prescription on a monthly basis?
Yeah. So there was never any shortage, Prior. That's another unfortunate narrative. There was never any shortage of CDAP drugs in the system. What happens with CDAP is a lot of the smaller pharmacies who don't have sufficient storage space run out of supplies. So when you go to that pharmacy, you get the impression there's a shortage of CDAP. The only drug on CDAP that was short was a drug called sodium valproate, was it, for epilepsy?
Yeah.
Yeah, a drug called sodium valproate for epilepsy because there was a global shortage. But insulin, everything is available. The problem is a lot of these smaller pharmacies can't stock the volumes. So when a patient goes there, they get the impression that there's a shortage of CDAP. There is no shortage of CDAP since this administration changed the way CDAP was administered, I believe, in 2018, where what we did was reduce the dispensing fee, which went up to $13 per item in 2015. We reduced it to $8 per item, and the savings, we put it into buying more drugs. So CDAP, there is no shortage of CDAP drugs. That's an unfortunate narrative. What you have are some of the smaller pharmacies who can't physically stock CDAP run out. And that gives the impression there's a shortage of CDAP. So I hope that answers your question prior.
Thank you. We go to 95.5. One question, please.
Thank you very much. Just to clarify my question earlier, what I was asking is that the cruise ship in St. Vincent has persons on it from both Trinidad and Tobago, so whether they'd be allowed to drop off the persons from Tobago in Tobago to quarantine before going to Trinidad and not trying to fly them from Trinidad to Tobago. My requests are for an updated GIS mapping of the current situation, and Minister Deyalsingh, whether you can have someone from NADAP come on to talk about alcohol consumption and COVID.
Okay, so on the issue of Trinidad and Tobago, let me say, we have one country, Trinidad and Tobago, yes, two separate islands, but it's one country with one overarching policy. The port that the cruise ship will come into most likely will be Port of Spain, based in Trinidad. Whether the person is from South Trinidad, Toco, Port of Spain, Scarborough, Charlottesville, they will be treated as one unit. If you try to separate them without testing them and send some to Tobago, you run the risk of having that, if they are positive, getting spread. We have one country with one overarching policy that is meant to protect Trinidad and Tobago. We don't separate people based on if they come from San Fernando. So the 33 people from Barbados, the 68 people that came in from Guadeloupe, we did not say, okay, who from San Fernando, go San Fernando, who from Port of Spain, go Port of Spain, who from Tobago, go Tobago. That is bad public health policy. We have a public health policy dealing with Trinidad and Tobago as one country. And the policy has worked absolutely brilliantly to date. Let's not start to introduce discussions into that policy which separates us and not has us following one policy. So if the cruise ship comes into Trinidad waters, where we may have some capacity, they will be housed in Trinidad until their 14-day quarantine period is over, or until they get 2 negative tests 24 hours apart. We did not break the policy for the 68 people coming from Guadeloupe. We did not break it for the 33 people coming from Barbados. We are not going to break it for the people coming from Caracas. So I hope, Mr. Turner, you could understand how the policy works in your best interest too, and in my best interest, and in the best interest of all people across the country.
Thank you, Minister. Thank you, Dr. Parasram. We are really out of time. It's 1 minute to 12. We've come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. Trinidad and Tobago, as our country continues to reopen, please be reminded that we need to adhere to the public health regulations in place. The positive case from a family who recently returned to Trinidad is a reminder that the risk is very present and COVID-19 has not disappeared. The infection rates in the US and the UK is proof that we are still fighting a pandemic. And the spike in Iran after that country eased restrictions is evidence that the threat remains real. We have been fortunate so far, but as more persons re-enter public spaces, now more than ever, we need to reinforce public health guidelines, which include hand washing, sanitizing, wearing a mask, and observing physical distancing. These measures offer us protection. Let us not squander our success. Let us not become complacent and join those citizens who insist on gathering in large numbers and doing so mere inches away from each other without a mask. The pandemic is not over. We have just been spared the brunt of COVID-19 because of our robust public health strategies. Please, let us not risk it all. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flattened and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.